Informing, educating, empowering,
improving the way you do business in an industry that's anything but static.
You're listening to the Agent Survival Guide podcast.
In today's episode, we're breaking down the recent changes to the marketplace and training, 2026 ACA Exchange and FFM certification information, written by Emily Ryan. It's time to start preparing for the 2026 open enrollment period. We'll discuss important certification changes and updates that you need to be aware of for the upcoming plan year. Let's get into what to expect from the Federally Facilitated Marketplace, FFM, certification, and state exchange trainings. Marketplace training deadlines to be aware of. The 2026 FFM certification will be available through the CMS Enterprise Portal Marketplace Learning Management System, MLMS, later this summer. A mobile version of the FFM training is available to take on the go. For agents utilizing HealthSherpa, this training is also available on the CMS Enterprise Portal. We typically cover industry news and updates in our Friday 5 episodes, so be sure you're following along with the podcast to stay up to date. FFM certification is required for agents selling in the federal exchange. If you only sell products in a state-based exchange, you'll need to complete the appropriate state-specific training. Some state exchanges open agent trainings as early as mid-July. All agents must update their MLMS profile on the CMS Enterprise Portal, in addition to completing the 2026 training course to be considered ready to sell. Let's look at important dates for the ACA exchanges in which Ritter is active, starting with federal exchanges. The 2025 version of the FFM training closed on July 11th. As of the recording of this episode, the 2026 FFM training release date has not yet been announced, but it typically opens in August. When it opens, agents can complete FFM training through the CMS portal, HealthSherpa, or INSX Cloud. Continuing education units, CEUs, are available through HealthSherpa and INSX Cloud in some states. Moving on to state changes. As of recording this episode, the opening of training dates for the following states have not been announced: Colorado, Kentucky, New Jersey, and Virginia. To stay in the loop, we recommend bookmarking the blog version of this episode. We'll be updating it as we get the information. We'll also have the links to each state exchange website in the episode notes. It's a good idea to bookmark the exchanges that you sell in to check for updates as well. Next, there are a few more state details agents should know about. As of the recording of this episode, Georgia's 2026 training is open. In Kentucky, in order to access Agent Portal through Self-Service Portal, agents and brokers must complete Kentucky Online Gateway, onboarding the required agent state-based marketplace registration web-based training. KFF has a complete list of all the state exchange websites. We'll have that linked in the episode notes for you. In Maryland, the 2025 training closed on June 1st, and the 2026 training opened on August 6th. Agents must apply and complete initial training to receive authorization to sell. Broker authorization expires after 2 years. Maryland Health Benefit Exchange will send a renewal notice no later than 60 days prior to expiration date. For New Jersey, agents and brokers must complete the Broker Intent to Sell form prior to completing certification training. New York does not have an annual certification. Instead, agents must certify every 2 years from their initial certification date. Finally, we'll look at the changes for Ritter's home base, Pennsylvania. Penny certification training will be unavailable throughout July and early August to prepare for the 2026 training, which will be available in August. And remember, check out the episode notes for KFF's list of state exchanges and all the resources we mentioned today in the episode notes. Before we go, a quick reminder that agents can get FFM certification through approved third-party vendors, with some third-party vendors also offering SBM certifications, like the one we recommend, HealthSherpa. They provide CEUs to participating agents, and these qualify toward Health Line of Authority requirements. HealthSherpa was approved to offer CEUs in 45 states for plan year 2025. The states that are not on the list are California, Minnesota, Nevada, New Jersey, and New York. Remember, returning agents are able to take a condensed training. Agents who are new to the ACA market and did not certify or missed a recertification deadline must complete the full individual marketplace training. We'll continue to bring you updates on important certification details. In addition to this podcast and the Ritter blog, we will be updating our certification center on the Ritter Docs site as we receive more details. If you have any questions, don't hesitate to reach out. You can get connected by emailing asgpodcast@ritterim.com or by reaching out to your Ritter sales representative. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan, script proofing by Sarah Ruppel, recording and production by me, Tina Lamoureux, podcast design by Urban Rivera. Rate and review our show on Apple or Spotify.